A deceased male reportedly had a tattoo, but it is not visible during post-mortem examination. Which structure should be examined? The right answer here is option C, lymph nodes. Tattooing can travel from the skin to nearby lymph nodes and remain there for many years. So, even if the tattoo has disappeared from the skin, traces of the pigment may still be found in the lymph nodes. Where are the remnants of the Wolffian ducts usually found in females? Here the correct answer is option B, leaves of the broad ligament. The Wolffian ducts mostly disappear during female development. However, small remnants may persist, such as Gardner's duct, which is found in the broad ligament. A woman develops a complete perineal tear 2 weeks after a home delivery. What is the most appropriate next step in management? The right answer is option D, repair after 6 months. A complete perineal tear detected weeks after delivery is usually managed with delayed repair. Waiting about 6 months allows inflammation to subside and tissues to heal properly before surgery. For how long can an employee with tuberculosis receive extended sickness benefit under ESI? The right answer here is option A, 2 years. Tuberculosis is one of the long-term diseases covered under the Extended Sickness Benefit Scheme of ESI. Eligible employees can receive this benefit for up to 2 years during prolonged treatment and recovery. In which type of analysis are both cost and benefits measured in monetary terms? Right answer is option D, cost-benefit analysis. Cost-benefit analysis converts both the cost and the benefits of a program into monetary values. This allows direct comparison to determine whether the benefits outweigh the cost. During which condition are prolactin levels highest? The right answer here is option D, 24 hours after delivery. Prolactin levels rise significantly during pregnancy and peaks shortly after childbirth. Around 24 hours after delivery, prolactin reaches very high levels to initiate and maintain milk production. Which disease is most commonly associated with Pauci-immune Glomerulonephritis? Here the right answer is option C, granulomatosis with polyangiitis. Pauci-immune glomerulonephritis shows little or no immune complex deposition on immunofluorescence. It is commonly associated with ANCA-related vasculitis, especially granulomatosis with polyangiitis. A person develops breathlessness after reaching an altitude of 3000 meters. Which of the following is not used in the management of this condition? Here, the correct answer is option A, intravenous digoxin. Breathlessness at high altitude is usually due to acute mountain sickness or altitude-related hypoxia. Oxygen, acetazolamide, and immediate descent are effective treatments. But digoxin has no role in protein management. A 4-year-old boy has progressive muscle weakness, difficulty climbing stairs, and trouble getting up from the floor. Muscle biopsy shows absence of dystrophin. What is the most likely diagnosis? Right answer is option C, Duchenne muscular dystrophy. It's usually present in early childhood with difficulty climbing stairs and a positive oversight. The hallmark finding is the absence of dystrophin protein on muscle biopsy. 2 students in a school are diagnosed with meningococcal meningitis. What preventive measure should be advised for their close classmates? The right answer is option C, antibiotic prophylaxis. Close contacts of a patient with meningococcal meningitis are at high risk of infection. They should receive antibiotic prophylaxis such as rifampicin as soon as possible to prevent the disease.